Cancer has killed so many people in this country. Cancer has orphaned so many children in this country. Madam Speaker, today, cancer is an equivalent of a death sentence in this country. Honorable Speaker, it should prick the conscience of this nation. It should prick the conscience of this Honorable House. Madam Speaker, it is time that this House takes deliberate and intentional mechanisms of sorting out the cancer menace in this country. Madam Speaker, many members here have been called to fundraisings when we attend several functions in our constituencies, majorly to fundraise for cancer. Madam Speaker, we have invested in so many things in this country. We have invested in agriculture. We have invested in education. We have invested in so many areas. Madam Speaker, there is a problem in terms of investment in cancer infrastructure in this country. Madam Speaker, the statistics are glaring. And I want to read out this house so that we get how nasty cancer has killed our people. Madam Speaker, according to International Agency for Research in Cancer, IARC, Global Can Report of 2018. Madam Speaker, in 2018, there were 47,887 cases, new cases annually of cancer in this country. And out of the 47,000 in 2018, the mortality rate of the 47,000 was 32,987. Honorable Speaker, that accounts to almost 90% of those new cases die out of cancer. Madam Speaker, that was in 2018. The current projection in this country is that almost 100,000 people die annually out of cancer in this country. Honorable Speaker, if you break down those statistics, it means if it is 90,000 per year, if it is 100,000 per year, then the mortality rate is 90,000 people die of cancer every year in this country. That means in every month we lose 7,500 people. Per day we lose 250 people in this country out of cancer. Per hour we lose 10 people in this country out of cancer. Madam Speaker, if that doesn't prick the conscience of these honorable members, if that doesn't prick the conscience of this country, if that doesn't prick the conscience of this government, then I don't know what does. Because losing 10 people per hour out of cancer in this country, Madam Speaker, that is a national tragedy. It is a national disaster of monumental proportions. Madam Speaker, we have a progressive legislation in this country known as the Cancer Prevention and Control Act of 2012. Unfortunately, Madam Speaker, that law as established is a skeleton. We need to give flesh to that particular skeleton of our legislation. Madam Speaker, the reason for that is the following. One is that particular legislation creates a National Cancer Institute of Kenya, NCI, which is an equivalent of the US National Cancer Institute. But, Madam Speaker, it is only an agency or a parastatal, but it is only a toothless bulldog that cannot bite because it is micromanaged by the Ministry of Health. Madam Speaker, it will surprise you that if you Google and you check the website of NCI, Kenya, National Cancer Institute, they do not have statistics of cancer in Kenya in the year 2013. What they are relying on, Madam Speaker, are the statistics of International Agency for Research in Cancer that was done in 2018. As we speak, the current projections that I've given here are merely projections, but not founded through research by the National Cancer Institute of Kenya. So, Honorable Speaker, I also call upon the committee of this House that is in charge of health to critically invite that committee to appear before them. I mean, the institute, the NCI, the National Cancer Institute, the committee invites them to appear before their committee to be able to ascertain the issues that have been raised in the report. Madam Speaker, the gist of this motion is to establish a fund to promote, to prevent, to control, and to treat cancer. Madam Speaker, the traffic that is in JKIA of our people seeking treatment in India is very huge. And the reason is that as a country, we have not been able to provide adequate and a comprehensive health care for cancer. Madam Speaker, research has shown that if cancer is detected at an early stage, then it can be able to be treated. The problem is that cancer in Kenya is detected at the last stages, and therefore it makes it very difficult for it to be treated. And if, Madam Speaker, we can be able to pass this particular motion and create that particular fund, then it will mean that people who cannot be able to afford the treatment of cancer can be treated in this country using the fund. So, Honorable Speaker, I invite the conscience of this House. I invite the conscience of this government to consider taking seriously the issue of cancer in this country. Members here have lost their relatives. Members here are taking care of families that have lost their relatives out of cancer. So it is incumbent upon this House to consider creating this special fund, thereafter allocating its resources in subsequent financial years so that we can be able to wipe out or we can be able to manage cancer so that we can be able to assist our people get proper treatment. Madam Speaker, I beg to rest the prosecution of this motion, and I'm calling upon my good friend, Honorable Duncan Maina Madenge, popular known as DMM, the MP for Nyeri Town, to second this motion. Thank you.
Very well, the Honorable Madenge.
Thank you, Madam Speaker. I rise to second the motion on the formation of the Cancer Fund. Madam Speaker, the funding in our health sector is inadequate despite several declarations that the Kenyan government is a signatory to, and especially the Abuja Declaration that requires us to put up to 15% of our national budget to health. Even more worrying is the fact that we are only at 7%, progressive as it may be. But even when we go to the national GDP, we find that only 2% of our GDP goes towards health funding. Madam Speaker, the cost of cancer treatment in Kenya, according to a research paper in 2018, assessing the direct medical costs of cancer care, revealed that the cost of cancer therapy varied with the type of cancer. Patients on chemotherapy alone require Kenya shillings 140,000, while those on treatment for surgery require 130,000 Kenya shillings. Those on radiotherapy require 120,000 shillings.